Hello and welcome. Thanks for joining us on CATAnetTV, the mobile health channel, where we feature inspiring stories about innovation in the mobile health sector. I'm David Farnes, the mobile health lead with CATA, and joining me today is Joshua Liu. He's co-founder and CEO of Seamless Mobile Health out of Toronto. Joshua, welcome.
Great, thank you for having me.
Great, well, really appreciate taking the time. Joshua, why don't you tell us and tell the audience what the problem is you're trying to address in the healthcare system and how your solution goes about fixing it?
Absolutely. So to give you a bit more background, I'm a physician who did my training at the University of Toronto, and midway through my training, I got very interested in a problem called hospital readmissions and did some research on that at UHN. And basically the idea is when a patient ends up in hospital for an illness or a surgery, when we discharge them back home, we send them home when we think they're safe and they're stable to go, and so we don't expect them to come back so soon afterwards. But unfortunately, for over 7 million people in North America, they come back to hospital within just 30 days of leaving, and these readmissions are incredibly costly, to a total of over $27 billion each year to Canada and the U.S. combined to our healthcare system. So I got very, very interested in how mobile health and technology could be used to better address that problem. So what I ended up doing was, with two colleagues of mine, an engineer and a computer scientist, we started a company called Seamless Mobile Health, and it's a technology company that enables hospitals and health systems to deliver higher quality surgical care and improve patient outcomes. So we decided to focus specifically on surgery to start, and what we do is we drive better patient engagement and self-management after their surgery through interactive recovery modules that patients can access on their smartphone, their tablet, or on the web. And we help patients collect important data about the symptoms they're experiencing and concerns they have. And then what we do is we drive better and faster remote assessments by delivering that data back to providers during the recovery. And then finally, overall, we're trying to drive better quality improvement at a hospital or health system kind of level by unlocking key insights and helping them perform advanced analytics on that data at a broader population level. And overall, what we're trying to do is improve patient satisfaction, prevent avoidable outcomes like emerge visits and readmissions, and help generate cost savings for the healthcare system.
Excellent, excellent. And Joshua, where do you have the solution up and running now? I think you have it up and running in both Canada and the States.
Well, so we're live right now with Baylor College of Medicine in Houston, and they're starting off with a trial at a hospital, and it's slowly expanding to a couple of other hospitals in the area. We're also working closely with hospitals here in Toronto. We're about to roll out with Toronto East General Hospital this spring, and a couple of other Toronto hospitals throughout the course of the year.
It's interesting that you've got it up and running in Houston first. Tell us a little bit about the experience about trying to roll out the service in the U.S. versus Canada.
Yeah, I mean, I think you'll find that we have incredibly motivated providers both in Canada and the U.S. But one of the distinct differences is that the government and market drivers for mobile health solutions like ours, those drivers are much stronger in the United States. So through recent legislation with Obamacare, they're having harsher penalties for things like too many readmissions, and starting this fall, they're going to be penalized for too many readmissions after surgery. So they're under probably more pressure to drive down costs and to try and adopt solutions like ours.
So do you have any advice for healthcare administrators here in Canada based on your experiences in both countries?
Yeah, I mean, I think what you'll find is that they're early adopters everywhere, both here in the States, and it's a matter of kind of finding where they are locally, where you're living. I think one of the interesting things that we're finding is that mobile health solutions are a bit newer to healthcare administrators here in Canada. So for quite a few hospitals, they don't have a framework yet for how to adopt, evaluate, and implement these kinds of solutions. So I mean, one of the things that we've been doing is working very closely with healthcare administrators here to help build out that framework. And I think one suggestion I have is to, if healthcare administrators here could kind of, work together, across hospitals and organizations and kind of build common policies and frameworks for how to work with, new technology companies like ours, it would definitely help smooth out the process.
Now, one of the things that I hear quite often from administrators is they're looking for metrics. They're looking to prove that, or proof of the solution. I guess with your trial in Houston, you'll be able to accumulate some metrics from that.
Yeah, definitely. With that trial, both in Houston as well as the trials that we're going to be doing here in Canada, both countries are really interested in metrics, and we're personally very interested in the data because we want to provide a solution that does create measurable value. So, I mean, some important metrics we look at are, one, patient engagement. Are they using it regularly? Two, patient satisfaction. Is it increasing those scores that everyone's collecting? And then, thirdly, patient outcomes. Is it driving down readmissions and emergency room visits, and catching complications earlier, and overall saving costs for the system. So, all of us are really interested in making sure it creates value.
Well, it sounds very good, Joshua. I really appreciate you taking the time today with us, and hopefully you'll come back to share some of those metrics and success stories with us later. As you know, CATA created a mobile health advisory board last fall, and one of our top priorities is to identify positive use cases and promote them throughout Canada to help administrators make good decisions in terms of adopting technology. And I think what you're doing at Seamless Mobile Health is a perfect fit for all of that. And congratulations on what you're doing.
Thanks again. Thank you, David. I'd love to come back and share those success stories with you.
Excellent. Thank you very much. So that's it for today on CATAnetTV, the mobile health channel. You can find out more or follow us online at CATAnetTV or at cata.ca/MHAB. That's the Mobile Health Advisory Board. Thanks for joining us. I'm Dave Farnes. Good day.